Good day, sir. I am Aira Lopez of BSN 13, and today I will be performing the return demonstration for administering anal medication. The purpose is to promote faster absorption of medication, to promote defecation among patients who have difficulty moving their bowels, to promote fast relief of symptoms such as fever, and also it is prior to major surgeries. For the assessment, we have to assess for the following such as the client's level of consciousness and ability to understand instructions, the client's vital signs, presence for foul anal discharges, hemorrhoids and anal irritations, the ability of the client to assume position, the intactness of the medication as well as the expiration date and color and appearance. So moving on now with the planning, we have to observe the 12 rights on giving medications such as the right client, right dose, right drug, right route, right time, right documentation, right assessment, right evaluation, right drug presentation, right motivation and approach, right to refuse, and right of the client to know the reason of the drug to be administered. Then after that, we have to perform hand washing before and after the preparation. For the materials, we have to prepare the following such as the hypotray with lining, the prescribed anal medication, the medication card, also 3 pieces of sterile gauze, a pen light or any other source of light like a drop light, and a garbage bag. So now moving on with the implementation or the procedure. So first we have to perform hand hygiene and put on PPE if necessary. And then identify the client, introduce yourself, and explain to the client or relative the procedure and the action of the medication. Because doing this process will ensure that we are giving the right medication to the right client. So, ma'am, ano po pangalan niyo at birthday?
Diana Lopez, September 27.
Thank you po, ma'am. Ako po si Aira. Ngayon po, ibibigay ko po sa inyo yung suppository po ninyo para po sa puwit po ninyo. Order po ito ni Doc. Okay po, ma'am? Thank you po. And then, now, place the hypotray onto the bedside table. Then, provide client safety, privacy, and comfort. So, we have important reminders upon providing those, such as proper positioning based on the procedure, by putting down the side rail on the side that we will work on while keeping the other side rail up. Also by spreading the curtain or closing the door during and after the procedure, and by placing the call light within the client's reach. So now after putting down the side rail on the side that we will work on, we will now assist our client into a left side lying position or left Sims position with the upper leg flex. And then we will fold the top bed clothes to expose the buttocks of the client. Ma'am, tagilid lang po tayo sa kaliwa. Taas po natin yung isang pinti, ma'am. Thank you po. So after that, we will now put on clean gloves. Then unwrap the suppository and lubricate the smooth rounded end. Because the rounded end is usually inserted first and the lubricant will reduce the irritation of the mucosa. And now, we will instruct our client to relax by breathing through the mouth to relax the external anal sphincter. So, ma'am, hinga po tayo gamit po yung bibig para po ma-relax tayo. Thank you, ma'am. So now, insert the anal suppository gently into the anal canal for about 2 to 4 centimeters deep. And then with the rounded end first. And then along the rectal wall using the glove index finger. Ma'am, insert ko na po. Then, put the client's buttocks together for a few minutes. So after doing so, instruct the client to remain in a side-lying or supine position for 5 minutes prior to the insertion of the suppository. Ma'am, ayos na po tayo ng pwesto. So now, we are done to assist our client into a comfortable position with raised side rails. And then, dispose all used materials appropriately and also rearrange the reusable ones. And then, remove gloves and PPE if used. Then, perform hand hygiene. Then now, we will assess for the effectiveness of the medication given as well as to document the administration of medication into the client's chart immediately, including the client's reaction to the medication after administration. And lastly, we will evaluate for the client's response to the medication within appropriate time frame.